Howdy, and welcome to Let's Talk Texas, the official podcast of the Texas House Republican Caucus. I'm your host, Jordan Overturf, Communications Director for the Caucus. Almost forgot my job title for a second there. Don't forget who my guest is today. State Representative Trent Ashby joins us to talk about HB 5. This is the broadband expansion bill that was outlined as an emergency item by Governor Greg Abbott earlier this year. The House has already passed HB 5 and sent it off to the Senate. And so got a chance to sit down with the bill author, talk about what broadband expansion means, what it means for the future of Texas, how it will impact education, telemedicine, all of those things. I really had a good time talking to Trent Ashby about this. Also, you want to stay around for the free Willy bill. That's all I'm going to say. All right, let's talk Texas. Your session going so far?
Well, good morning. Thanks for having me on the podcast this morning. My session's going really well. I have enjoyed, of course, we're over the halfway point at this juncture, and of course, every session is different. But this session has been really quite a ride. There's a lot of firsts for a lot of members, including myself. And of course, the pandemic has made things a little bit awkward, especially as we kind of got started with a lot of the protocols that were in place. But, one of the things that I've been a little surprised about is that, on one hand, I feel like that, maybe we're a little behind as far as kind of passing some bills, just generally speaking, not think about any particular bill. But yet, when you look at where we are to date in terms of the House passage rate of bills versus prior sessions, we're really right on track.
Yeah.
And so it's kind of thrown me off a little bit from that respect. But as hopefully all your listeners know, we're in fourth gear for those manual drivers out there. And we are really kind of in our main stride and then in the stretch of session now. But no, my session's going really well. I've been very pleased. I've had the opportunity to, at this date, lay out all my bills, and there's just a couple I'm trying to get out of committee, which is forthcoming. So no, I'm very, very, very pleased.
Well, and not some insignificant bills at all. Carrying a key piece of not only one of the governor's priority, but one of the central pieces of this Healthy Families, Healthy Texans initiative that was rolled out last week with the Speaker's office. So House Bill 5 already passed in the House. So for those who weren't following along with the amendments to update everything, first talk to us about what broadband expansion means, and then let's go through some of what this bill is going to do to help bring Texas into this new era.
Absolutely, be glad to. So, as you indicated, Jordan, House Bill 5 was one of the emergency items as designated by the governor at the very beginning of session, and rightfully so. As everybody is well aware of now, a lot of things, positive and negative have really come out of our experience with COVID-19, but one of those for frankly a lot of my more suburban urban colleagues has really been to showcase the absence and dearth of broadband or connectivity access in our rural parts of the state. And as a rural lawmaker, of course, since I've been here now in my fifth session, it's always something that we've been nibbling around the edges at and trying to kind of raise to that level of, hey, we need some help in rural parts of the state to not be left behind. Mm-hmm. And as the governor rightfully said in his designation, internet and broadband specifically, it's no longer a luxury. It is absolutely a necessity to live in this country and certainly in our great Lone Star State. And we want to be a leader in driving out that connectivity to all zip codes, all regions, every corner of the state of Texas. And House Bill 5 was our attempt on the House side to really not just raise the bar and meet that objective, but really to become a national leader in what other states should be looking at in terms of modeling in their own respective states about how to go about bridging that digital gap. And so, yes, there's a lots of parts to this bill. I'm glad to talk about anything in specifics, but just generally, you know, I would be remiss if I didn't say this. This bill has been many months in being talked about, worked on. We've had well over 100 stakeholders at the table, working with our office and other offices on, you know, presenting the best bill that we can. And so there's just a lot of people out there that I want to thank, not individually, but just collectively, because I'm certainly no expert in broadband, although I've gotten to know a little bit at this point. But there are a lot of people who are the experts out there. And when you talk about, you know, rural, when you talk about urban, suburban, you know, you really, you know, and I think it's important for your listeners to understand that, you know, I'm a rural lawmaker, and for me, my biggest issue with broadband is lack of access. But what really surprised me and what really drove the unanimous bipartisan vote we saw on this issue is in our urban core areas, in our suburban parts of the state, there are millions of Texans, not hundreds of thousands, but literally millions of Texans that have access to it. The term we use is they're not adopting it or subscribing to broadband. And so in House Bill 5, we dig down into that issue of directing our now new broadband office, statewide broadband office, to figure out in development of our plan how we can get Texans to not just have access to it, but importantly, how we can go about helping them subscribe to it. And so, anyway, I'll hit pause right there, but it just, again, thanks to everybody on the member as well as all of the stakeholder side that had some input in this bill.
Well, no one can say you don't have passion on this issue. So let's start with defining what broadband is. For people who don't really understand, you know, for years have seen millions of internet commercials, but not really understanding. And one of the parts of this bill that I thought was interesting is you go in and actually define what high-speed internet means, correct?
Correct. In great question. And I'll admit, I didn't know what broadband was. I mean, I've heard about broadband, I don't say my entire life, but, last 15 years, people talk about broadband. But really, simply put, broadband is defined by the FCC as 25 megabit download capacity and 3 megabit upload capacity of data from the internet. And so essentially, it's just a certain level of speed of the internet that any of your listeners or users might have. And so that's really all broadband is. And the federal government, again, through the FCC, they define what that speed capacity is that is classified as broadband. As your listeners probably can gather, as technology continues to march forward, that speed level will increase. And so one of the things that was very important in House Bill 5 is that we explicitly state that we define broadband in the state the same as our federal government does at the FCC. So as the FCC, let's say in 5 years from now, as they move up that broadband speed to a new definition of broadband, that automatically the definition of broadband in the state of Texas will match that. So we will never have to go in and touch that speed again. It will always move with the new definition of broadband.
So have stakeholders explained kind of what that download speed gets folks and why it's kind of that crucial benchmark to hit in terms of high speed?
Yeah. So again, it's a great question. Yes. Just real quickly, I talk about stakeholders, and certainly top of the list have been our internet service providers. And what's interesting is, if I were to, ask each of your listeners this morning, who is your internet service provider? Well, in some cases, it's going to be, top of mind. It'll be, cable. or it will be, wireless, fixed wireless, or fixed mobile. It's a hotspot off of a cell tower. In other areas, especially in rural areas with limited broadband capacity, it's going to be DSL. And of course, this year we've seen the emergence of and further kind of next generation development of satellite broadband, which a lot of people are signing up for now. The new Starlink.
Mr. Musk is listening. I'm sure
Mr. Musk is pushing that, and so. We've had all of the industry representatives from all of those technology into this discussion about broadband. But yes, the broadband definition is basically the speed in which you can, when you hit click on your computer to launch a website or to place an order or whatever the case, how quickly you can get a response. And then if you're trying to download an image, how quickly you can get that. Nobody wants to wait, 5, 10, 15, 20 seconds, just to get to a page on the internet. But yet, in some of our older technology, that's what many users, unfortunately have to face, especially in rural parts of the state that have limited access to internet. So we're trying to bring everybody up to, I think what the expectations are today. And it's only going to develop as we get, beyond into 5G statewide, and then beyond whatever the next generation of that G would be. So people are increasingly going to expect more instantaneous results on their internet searches and downloads, and rightfully so. And so basically, this will allow folks to keep up with that. But again, it's all driven by our industry partners, and my tip of the hat to them. Certainly, they have had a big hand, Jordan, in getting us to House Bill 5, a workable bill, and they're all supporting it. And I will say, just to thread that needle, we had to make sure that we were technologically agnostic. And so we're not picking, just so your listeners are aware, we're not picking any winners and losers in terms of the type of broadband that you might have. We create a level playing field. And again, we have all of those industry representatives at this point supporting the bill.
Well, I will tell you, young people everywhere are crying out fiber, but
understand.
We'll see what happens with Elon and Starlink and how successful that is. Astronomers are upset with him and all of his satellites that he's putting out there. He's ruining the night sky, which especially in West Texas, big sky country, that is important. But I want to narrow in on some of the what I call doors of opportunity that this broadband expansion opens, because you've already touched on the education component and remote learning through COVID, but also beyond that, what this opens for just independent learning and education, economy, creating jobs, allowing people in rural parts of the state to now have access to the gig market, but the more crucial component that we're talking about a lot this session is obviously the healthcare aspect. Just saw that there will be, is it Wednesday, we're going to have telehealth on the House floor. So that next piece of the puzzle is coming in, as you've discussed with Representative Price, who's carrying that bill, and the other members who are working on this telehealth component. Where does broadband fit into that that puzzle?
Yeah, it's absolutely an essential component. You can't have House Bill 4 without House Bill 5. And again, I want to applaud, first of all, the Speaker, Speaker Phelan, for really leading and putting the House out there, talking about, the Healthy Texans, Healthy Living Initiative, because as I go back to my district, and I think, largely all districts, healthcare in terms of access and improving the affordability, improving outcomes, that is a top-of-mind, kitchen-table issue increasingly that I hear about from my constituents. I put it as easily a top 3 issue in my district. And so I've been really pleased to see the Speaker lead on this issue and push out a package of bills that will help Republicans, kind of paint our mark and say these are our goals, and this is where we're headed, and I agree with him, and certainly back to House Bill 4, which will be on the floor Wednesday. Critical piece of legislation. I'm a joint author of that bill. And again, I know this has already taken place in many parts of the state. Rural, again, because of our lack of connectivity, has been kind of behind the curve on this. But again, the pandemic has laid bare the challenges that we face in terms of access to medicine. And just as a quick data point for your listeners, in the last 50 years, we've lost over half of our rural hospitals and health clinics. Mm-hmm. And so when I look at, like, district, he represents Orange County, a county of 90,000. They don't have a hospital in that entire county. Since I've been in office in the last little over 8 years, I've lost 2 hospitals in my 6 counties. And so this is a huge issue, what House Bill 4 does to help solve some of the problem in terms of bringing medicine to the customer in their own comfort of their own house. And we saw a lot of that throughout the last 13 months of the pandemic. Increasingly, our physicians, our nurses have scheduled telehealth and telemedicine visits, and I've taken advantage of that. Yep. And I was a skeptic.
Same.
I'm no longer a skeptic. Mm-hmm. It was wonderful. I didn't have to drive the 15 minutes to the clinic. I didn't have to, wait in the waiting room for an hour, it seemed like. And we were able to do that from the comfort of my own home. And so it was great. But I was only able to do that because I had internet capability. And anyway, but no, what Representative Price is leading on here, which he's really, since he's been in the House, he's been a leader in healthcare, is really kind of what I consider the next step in terms of providing our constituents with what they expect in terms of access to health care. And so anyway, I'm excited about this for the House, and I applaud Representative Price for getting us to this point. I'm looking forward to supporting that bill later this week.
Yeah, and when I had Chairwoman Click, shout out episode 2 if you want to go back and listen, she was talking a lot about telehealth being a big part of leading Texas into this new era of healthcare and access, and how it's been kind of discovered that it's not just telemedicine that we're talking about. We're talking about mental health applications, dental applications, so that way you can have cleanings and things like that, and then have a consultation. But the thing that's been really impressive to me is I've already seen this in the private sector with certain hospital models related to cancer treatment, right? And they create these satellite hubs where you create these points of entry or access to where you start the process, right? So telehealth is just taking that even one step further, so that way people who may be nervous or reticent to go into a clinic may have that tamped down a little bit when you're in the comfort of your home and you can have a conversation with a doctor. You have family there, maybe family who can't even travel to the clinic with you. So I think it really does provide an amazing opportunity for Texans, and I'm proud of seeing this go forward. So congrats to you on passing HB 5, and now looking forward to HB 4 and the debate that'll come with that. But you've got other bills that you've been working on as well. So before we get out of here, what's some of the other stuff that you've been pushing this session that you're proud of talking about?
Yeah. Well, let me mention 3 bills briefly.
Okay.
3 that come to mind. One of them, which I'm laying out this week before appropriations. Let me start with that one. This bill passed the House almost unanimously last session, but this is this is one of those bills that just makes good, to me, common sense, and that is, as your listeners may be aware, in a lot of our counties, not all of our counties, but a lot, over half. The more populated counties for sure, we have what we call specialty courts across the state. And the most common specialty court is the drug courts that many of our state district judges lead in their respective districts or counties, depending on how their district is set up. In my home county of Angelina, I have a district judge that really has helped me on this issue. And the data is just so overwhelming in terms of the minuscule expenditure from the state level to give our state courts, and they are bringing in folks that struggle with, in many cases, it's drug or alcohol abuse. And then, of course, we also have other courts, just as an aside, Veterans Court, mental health courts, et cetera. But I'm going to focus on drug courts because that's the most prevalent one. But for every dollar that we invest of our public taxpayer dollars at the state level, we get an almost $5 return on that in terms of the health outcomes for that individual. And recidivism rate is reduced by 70%.
Wow.
Of that person committing another crime and going back to jail or prison. And we ultimately lead this person to hopefully a productive lifestyle where they will get out and get clean, get a job, and be a productive member of society. And that's what, as Republicans, that's what we want. That is good conservative government. That is a huge return on our investment. And so I have a bill essentially that would take 1% of the already collected mixed beverage sales tax. So people that are out buying alcoholic beverages that's remitted to the comptroller's office, 1% of that under this bill would be directed to our specialty court system.
Okay.
Because the challenge that we face is the funding. There's a lot of counties that want to either put one in place, stand it up, or they want to put another one in place because they're so wildly successful. But the issue is funding, and so this bill addresses the funding sustainability issue for those drug courts. That's one. A bill that I have on the floor today, it deals with prescribed burning.
Okay.
In Texas, we have about a little less than 70 certified and insured prescribed burners, basically that go out and set off prescribed burns.
Yeah.
But what we have seen is a little cottage industry of litigation that has moved forward. So if there's an accident, let's say, and you're within 20 miles of someone that has to, and these people have to file a plan with the state, the county sheriff, the Forest Service, before they do the burn. Well, if there's some attorneys out there that if they see an accident and there was a burn, within 10, 20 miles, which is way outside of, the normal scope where you would expect smoke to be any issue, a lot of times they'll bring into the lawsuit these handful of prescribed burners, or the one more specifically that was in charge of that burn. So all this bill does is try to provide some additional liability for those folks, so that we're down to one insurance company that will provide any insurance for these guys that provide a humongous service, especially for our wildland interface areas, the high growth suburban areas where prescribed burning is an absolute critical. Or we're going to become California.
Yeah.
And the wildfires and the devastation that we've seen, if we don't continue to burn, we will become California. And so this just continues to help our citizens as well as these individuals that are in that industry, secondly. And then lastly, I have a bill, and this is one of these just scratch your head kind of bills, but there's about 10 to 15 primarily church camps across the state, and they have these slides that are called Wet Willys. The Wet Willy slides. And we have, unfortunately, in statute, language that basically draws them in to requiring the same amount of insurance coverage as we require for Six Flags, Wet n Wild, Schlitterbahn, and the annual inspection from the state, and they have to pay the inspection fee. And so what's happening is a lot of these, again, primarily church camps, have basically said, we can't afford it. Like, we just can't afford to pay the insurance and this annual inspection. So they're not providing the slide. Willy. And so we have the free Willy bill this session that is passed out of committee unanimously. We'll hopefully have that to the floor. But that's just an example of, a lot of my colleagues have these bills that are just head scratchers. Like, I can't believe I'm having to carry a bill to correct, this.
Did it make it into the bill caption? That's what I want to know, how this ended up under the radar, and how are you going to face the floor comments? Because I can already hear Richard Pena Raymond bursting at the seams to ask you questions about these slides. What is this bill number?
I don't remember off the top of my head.
You know what? Corrections Department, look, for the preview of this episode and the post, we're going to put that bill number in, and we'll link it in the comments. So make sure you're subscribed to the podcast, because otherwise you'll miss out on the free Willy bills. Representative Ashby, that's all I got for you. For folks who want to stay connected with you, find out updates on what you're doing down here, where do they go find you on social, website, all that stuff?
So I have a Twitter account, but my main outpost for information about what I'm doing in Austin is on my Facebook page.
Okay.
My public Facebook page.
Yep.
And I would encourage anybody. I post periodic updates throughout the week, but every Sunday I have a weekly column that I run in all of my newspapers across my district, and so every week there's a good summary of kind of what happened in Austin over the last week, and I encourage anybody to go take a look at that.
Excellent. Well, we appreciate you coming in, giving us a little update. And if you want to find his social media, all that stuff, you can actually head to our website, texashousecaucus.com. Go to the Our Members page, find Representative Ashby. He's kind of high at the top, alphabetically. Ashby works out in your favor. Facebook, all those links and stuff there. Representative Ashby, thank you again. And maybe we'll bring you back after session's over. We can figure out where we landed on all these bills and talk about some of the successes we had.
Absolutely. Thank you, Jordan. Thanks for having me on.
Thanks. All right, thank you again to Trent Ashby for joining us. Thank you to you for tuning in. As always, you are wonderful. We appreciate you. Thank you so much to everyone who has been listening to this podcast, giving us great comments and feedback. If there are specific guests or bills, issues, you know what I'm talking about. There's specific topics you want us to talk about or specific guests that you want to hear from, make sure you fire off in the comments below this video. Make sure you find us on Facebook, Twitter, and Instagram at TXGOP Caucus. As always, you can also head over to our website for more information. That's texashousecaucus.com. Be sure to check out the members page where you can find every connection you could think of for your member. Their Facebook, Twitter, if they have an Instagram, their district website, their personal websites, their district and capital phone numbers, emails, all of that stuff. A great way for you to go ahead and connect with your state representative and just get those updates. And while you're there, make sure you follow us. Of course, if you're watching this, you're probably already following us. Maybe. I don't know. That's a quantum quandary for later, I guess. I don't know. Another episode. We'll see you guys next time.